illnesses and disability suffered by the littlest patients, unborn babies, as well as newborns. They enhance both the child's health and longevity. Abortionists, on the other hand, take a far different approach. They dismember and chemically poison children to death for profit. For decades, babies have survived later-term abortions. A Philadelphia Inquirer story some 37 years ago called baby survival the dreaded complication. In other words, it's a complication that a child survives. I got involved in the pro-life movement when I read an AP story of a child that survived a later-term abortion. And the abortion rights movement then, it was in 1972, before Roe versus Wade, it was in New York, were apoplectic about it because the baby survived. That should have been a reason for rejoicing. Dr. Willard Cates of CDC was breathtakingly candid when he said, live births are little known because organized medicine, from fear of public clamor and legal action, treats them more as an embarrassment to be hushed up rather than a problem to be solved. It's like turning yourself into the IRS, he said. What's there to gain? The tendency is not to report because there are only negative consequences. An undercover investigator asked an abortionist, what do you do? What's your protocol when the child is born alive? He said, the key is you need to pay attention to who's in the room, right? That was what he was quoted as saying. We are talking about cover-up, ensuring that the people that are in the abortion clinic all gag themselves and not speak to the truth of what has happened. A baby has been killed after birth. The legislation today requires a significant penalty that healthcare practitioners present at the time that the child survives the abortion, exercise the same degree of professional skill, care, and diligence to preserve the life and health of the child, and then get them to a hospital. This is humane legislation. I urge my colleagues to support it.